Hi everyone, I'm Ed Paget, and today we're going to be talking about scoliosis exercises. If you or your child has scoliosis, you're probably familiar with the Schroth method. It's one of the most well-known scoliosis-specific exercise programs out there. But what if it's not the right fit for you? In today's video, we'll be looking at 3 alternatives to the well-known Schroth method for these exercises. Each of these methods takes a slightly different approach, and by the end of this video, I hope you'll feel more informed about the options available to you. But before we get to these specific approaches, if you appreciate videos like this, all I ask for you in return is to hit that like button or subscribe, because doing so helps out this channel tremendously, and in return, I'll do my best to respond to as many comments as possible. Thank you so much. Now let's begin. Let's start with the Schroth method. It's one of the most well-known approaches to scoliosis management available today. And this method was developed by Katharina Schroth in Germany in the 1920s. Now, interestingly, Katharina herself had scoliosis, and much of her motivation came from her personal experience. Now, at that time, scoliosis treatment was limited, and for many, the condition was caused or worsened by other health problems, including things like tuberculosis. Over time, it became a widely used tool for scoliosis patients for all causes, especially idiopathic scoliosis, which has no specific cause. Now, the method focuses heavily on rotational breathing, postural correction, and specific muscle activation to counteract the asymmetry that scoliosis creates in the body. Through conscious breathing and exercises aimed at expanding the compressed side of the body, the goal is to achieve better spinal alignment and muscle balance. The method was developed further by Katharina's daughter and other family members, and the method has evolved and it is being used widely, especially in Europe, as part of scoliosis rehabilitation. Now, one common question I hear is, can the Schroth method actually reduce a scoliosis curve? There is some evidence to suggest that it can, especially when started early and combined with bracing in growing adolescents. For instance, a small 2015 study on 45 people found that adolescents with scoliosis who practiced Schroth method 1.5 hours 3 times a week under supervision of a specialist had significantly better chance of reducing their cob angle, which is the angle of their scoliosis, compared to those who practiced at home without supervision or who didn't even do any exercises. The research on adults is more limited, but there is evidence that it can improve posture and reduce pain, even if curve correction may be less likely in those who have finished growing. Now, while Schroth can be effective at attaining small reductions in curves, some people find the method too time-consuming and difficult to learn without professional guidance, which can be a problem for those who don't have a Schroth-trained therapist in the area, or when they try and they do the exercises at home without a therapist, they just can't make it work for them. Now, interestingly, there are many schools in Europe that certify physiotherapists in the method, but standards may vary across each different educational provider because there isn't a central governing body for Schroth method that maintains the standards. Also, for reasons that aren't entirely clear to me, Schroth seems to be limiting its ability to help people with scoliosis by only offering the training to physiotherapists, to the exclusion of athletic trainers, chiropractors, and osteopaths. Now, as much as I would like to take the Schroth training, I can't, because it appears that I would have to do another 4 years retraining as a physiotherapist first. The Clear Institute offers another alternative for scoliosis treatment. Founded by a chiropractor, Dr. Dennis Wogan, in 2000, this approach is based on chiropractic principles and involves specialized equipment, vibration therapy, and specific exercises. Now, CLEAR is actually an acronym for Chiropractic Leadership, Educational Advancement and Research. And with its 20-year history, research is still being produced. They have had some positive case studies though, which is where all the research starts, and hopefully they can find the funding to do more rigorous case control studies in the future. However, parents and patients have reported positive results in their experience, and personally, I think this method is very innovative and shows a lot of progress. One of the downsides might be the length of time and the amount of equipment needed to complete their protocol, and like Schroth, that's for physiotherapists, CLEAR seems to be just for chiropractors. Spiral stabilization is a method developed by Dr. Richard Smenek from the Czech Republic in the 1980s. Now, this approach emphasizes the use of elastic resistance bands to create spiral muscle patterns that help elongate and stabilize the spine. Its focus on posture correction and movement coordination is key. Although it's been used in Europe for decades and actually has whole hospitals using it in China and Korea, it's only just gaining recognition in the UK, US, and Canada. And any therapists can learn this method, and the Smenek family are very forward-thinking when it comes to sharing their ideas. Spiral stabilization works on the theory that spiral movements can help decompress the spine, which may prevent the progression of scoliosis. Now, interestingly, you can see this in action when you rotate. If you twist your spine to the left or right, you can actually feel yourself getting a little bit taller. This is due to the anatomy of the joints of our spines and how they slide over each other when we rotate. I actually studied with Dr. Smelik and was impressed by his case studies. Again, as this method isn't that old, like Schroth, it hasn't got a whole bunch of research behind it, and it's essentially been driven by one man. So larger scale studies at the moment aren't available, but I've seen its effectiveness in reducing curves, and I got great results using this technique myself. And now I want to talk a little bit about the method that I've been developing over the last 10 years. It's called the Scoliosis Correction Protocol. This approach combines my training as an osteopath, exercises from the Gray Institute, anastomotic spiral stabilization, and many other techniques that I've learned over the years. Essentially, if it works, I'll include it. Now, I've divided the course into three main areas: evaluation, which is finding out what's going on in the entire body that could help or hinder the scoliosis; isolation, specific exercises for specific imbalances within the body; and then integration, bringing it all together in a sustainable program for people to follow at home. Now, what sets this method apart is its focus on exercises that can be tailored to the person's specific curve and posture online. Patients don't need to fly or travel to the only therapist in their city, state, or sometimes even their country. It can all be done from the comfort of their own homes. Now, have a look at my scoliosis playlist here on YouTube to see how effective coaching online can actually be. Now, while the protocol is still growing in terms of research, we have great case studies and are currently working with a university in Portugal to look at our effects on the lifestyle factors of adults who have scoliosis. Okay, so there you have it. Each of these methods has its strengths, and the right one for you or your child will depend on the factors like curve severity, age, and your personal preferences. While Schroth has the most research behind it, newer approaches like spiral stabilization and the Clear Institute are gaining traction. And of course, I believe the Scoliosis Correction Protocol is a fantastic alternative that shows promising results. The key takeaway here is that surgery isn't the only answer, even though many doctors would have you believe that it is. There are things that you can do right now to start strengthening and mobilizing your back, and it's important to explore your options and choose what feels best for you or your teenager. If you're interested in learning more about the scoliosis exercises or want to explore the Scoliosis Correction Protocol, be sure to check the link in the description. And as always, please like, subscribe, and leave a comment if you found this video helpful.